Almost half the people in the United States over the age of 65 experience some form of hearing loss. But there are things you can do at a young age to reduce the risk of losing your hearing. We sit down with family medicine doctor Greg Copeland of Community Health Partners to learn about hearing loss treatment and prevention.
It's actually not just a quote-unquote old person's thing. It can happen in younger years. Sometimes there's just a history of trauma, loud sounds, people who work in construction sites or listen to too loud of music when they're a kid, and that does neuronal damage. So it's actually fairly common for younger people as well.
And some symptoms of hearing loss might be more common than you think.
Noticing that certain sounds aren't coming through as clearly, maybe perhaps a television, or certain people's voices oftentimes you can't hear. Husbands and wives will oftentimes come in and say, he's not listening to me, and he says, well, it's because I can't hear you.
There are two types of hearing loss.
Conductive, which has to do with the little bones in your ear and the vibrations of the sound that come through to those bones behind the eardrum. And then there's neuronal or neuron hearing loss, which has to do with the nerves and the structure that lives behind those bones.
Patients can find online resources to treat hearing loss, but Dr. Copeland recommends going directly through your local primary care physician to find the best treatment plan for you.
That's really our job, is to educate and teach the patient. When you start to notice hearing loss of any type, my recommendation is to make an appointment with your primary care doctor. They'll typically refer you to a specialist called an audiologist. And they'll run a series of tests that they can determine exactly what type of hearing loss you have. They can give you kind of a really good layout of what type of hearing loss you have, what the best treatment for it is, and whether or not you'd be a candidate for hearing aids.
If you find yourself in need for hearing help, today's hearing technology has greatly evolved.
They're actually quite advanced these days, where they're connected to your cell phone with Bluetooth. You can answer cell phone calls through your, almost like having an earbud in. They can be adjusted remotely, you know, for ambient background noise. They're very, very advanced. And so if you have an opportunity to be tested for hearing aids, I'd say just don't be closed-minded, because a lot of this technology is really, it revolutionized a lot of people's lives.
Overall, Dr. Copeland says taking preventative measures could play an important part to longevity of healthy hearing.
Ear protection is the number one thing. If you work in a place that has a very loud environment, you know, earplugs are important. Listening to the people around you and being open to the idea if someone is telling you, hey, you're saying what a lot, or you're missing things in conversation.